Hi, it's Dr. Lisa. We're out in the community again today. We're talking to people about the new CDC recommendation about masks and also the Pfizer vaccine for children ages 12 to 15. Let's see what people have to say. Did you hear the CDC is now saying if you're fully vaccinated, you don't have to wear a mask in public or indoors?
Yes, I did hear that.
What do you think about that?
Me personally, I think it's interesting because how do we track if everybody is fully vaccinated? And many may think because my friend is vaccinated, that means I'm good, so I can take my mask off too.
I believe that it's a little too soon to remove the mask. I'm going to continue to wear mine, and I'll probably wear mine for a very long time, as a matter of fact.
I think it's crazy.
Really? Why?
Just because I feel like the vaccine was pushed out a little too fast. We're still working on cures for other things, and it just leads me to question the accuracy of the vaccine and if it really works. I know a lot of things with medicine is trial and error.
Honestly, I'm really not sure what to think, and the reason is that we're still trying to figure this out in terms of what's working, what's not working. If you're fully vaccinated, some folks are saying you need 2 weeks to be considered fully vaccinated after the Johnson & Johnson shot, or if after you received your second Moderna or Pfizer shot. I think some people still have apprehensions, and I think it's okay to still be a little bit more cautious and, to ride this thing out for about another month.
I think that it's too early for us not to have any masks whatsoever, for everybody to have them off, especially since we're not what they call herd immunity at this point.
The decision to wear or remove your mask is a personal one. After all, we've been wearing them for many months, and now they can make us feel safe. But people who are fully vaccinated are unlikely to get COVID-19 or to transmit coronavirus, which means it's okay to take off your mask. However, people who are unvaccinated can still transmit coronavirus and should still wear them because they reduce the chances of spreading coronavirus to someone else who's not vaccinated. And so Pfizer approved the vaccine for 12 to 15-year-olds. What do you think about that?
I just think that parents should still be involved. Even if they give your child the option to make the decision alone, I think that you should enforce in your household for your child to definitely consult with you if it's something that they would like to do.
We really don't understand, and it's hard to trust a system that you feel has mistreated you for so long.
Yeah. Have you been vaccinated?
No, ma'am, I have not.
Why not?
I haven't been vaccinated because I had a bad reaction to the flu shot, and because of that, my doctors have recommended that I don't get the vaccination because of that.
No, I have not.
Why not?
I'm not a fan of vaccination, but I encourage people to do it.
That is a HIPAA question that I will tell you in about 2 years.
That means no.
I definitely feel for something so serious that we should have had a little more time to try it out to make sure it is 100% effective before pushing it on people. I know that there were 2 types of vaccines that you can get. I know one was made by Johnson & Johnson and another company, and Johnson & Johnson has already received a lot of backlash, and they have canceled that vaccination. So it just worries me. So my child won't be getting that vaccine, and we will definitely stay masked up, mask over your nose.
I believe everybody have their own view on the vaccination, so I don't push my viewpoint on others. But I definitely keep it open for folks because you never know.
The vaccines were produced in record time because we're in a global pandemic and the economy collapsed. We needed to move quickly. The process was quicker because scientists were already working on vaccines. Thousands of people immediately volunteered to be in the research studies, and the government paid for the vaccines, which allowed the process to go faster. The side effects we're seeing now were identified in the studies, and while vaccines have side effects for some people, they've drastically reduced the number of deaths and hospitalizations from COVID-19. Parents are free to guide children about whether or not to get vaccinated. Having a reaction to the flu shot doesn't mean you will have a reaction to the COVID-19 vaccination. The Johnson & Johnson vaccine is not canceled. It's still in use and active against variants and effective at preventing deaths and hospitalizations from COVID-19. So who should people get the information from? Who are the trusty messengers you think that could?
I'm gonna be honest, that's very difficult. We know we still live in a capitalist society. We know that a lot of medicine in some spaces is driven by how much money people can make off of it. And just to be honest, I'm not really sure.
So we still have a lot of work to do to educate the community about the vaccine and about the pandemic in general, but more importantly, about bridging trust between the government, our healthcare system, and the public health system. If you have questions about the vaccine, about the pandemic, or if you just want us to hear your comments or your opinions about the vaccines, about CDC recommendations, about the masks, just leave a comment below. And don't forget, hit the subscribe button. I'm Dr. Lisa, and I'll see you on the street.